and welcome to the Dr. Bob Show. How's your memory? Do you have trouble remembering things, word searching? Oh, where was it that we ate last week? Are some of your problems normal, or could you begin to be getting a form of Alzheimer's? That's what we'll be spending most of this show talking about: Alzheimer's or its variants, or what is Alzheimer's. My guest is Dr. Monica Crane. Dr. Crane is the medical founder of Genesis Neuroscience, and she'll be answering our questions. Hello, I'm Dr. Robert Overholt. I'll be your host for the next 30 minutes on the Dr. Bob Show, and we've got a great show lined up for you. We'll be spending most of the time talking about the diagnosis, treatment, and what's new in the world of dementia and Alzheimer's. You'll want to stay tuned. We're talking with Dr. Monica Crane, medical director and founder of Genesis Neuroscience right here in Knoxville, Tennessee. Monica, welcome to the Dr. Bob Show.
Well, thank you, Dr. Bob. I am delighted to be back and talk about Alzheimer's, the new treatments. It's an exciting time.
It really is an exciting time. Well, what is Alzheimer's?
So Alzheimer's disease is a form of neurodegenerative dementing illness.
Neurodegenerative illness.
Yes,
now,
of the brain. So
of the brain.
Yes, so degeneration of the brain. And the word dementia sometimes is used to describe Alzheimer's disease, but actually the word dementia is a broad clinical term that I don't like.
Oh, so you don't like the word dementia?
No, because it doesn't mean anything. They're actually talking about changing and getting rid of the word altogether and calling it adult neurocognitive disease.
Adult neurocognitive disease. What would be some of the things included in that?
So included would be Alzheimer's disease, vascular dementia or vascular disease, Parkinson's disease, Lewy body disease, the different frontal temporal dementias. There are many, perhaps even like CTE, chronic traumatic encephalopathy. So there are many neurodegenerative diseases. There are rare ones as well, but really Alzheimer's is the most common neurodegenerative disease of the brain.
How do you figure out who's got what?
So the first step is recognizing symptoms, but hold on there. I think the way we are going to diagnose in the future will not to be wait until symptoms. So waiting until symptoms is like waiting for a cancer to appear and then screening.
So how do you find pre-Alzheimer's or pre-dementia-like diseases?
So hopefully we will have blood tests. We know that there's new imaging, but at least we can screen aggressively and do cognitive testing. And when a family member or a patient says, I think I'm having a problem, not dismissing that, and instead acknowledging that maybe they have mild cognitive impairment. So mild changes that do not impair activities of daily living, so you're able to even work, but having mild memory problems that are a lot worse than previous.
So what are some of the tests that we can do to let me know if I may get Alzheimer's in the future, or if I've got a little bit of it, or you don't have to go through a bunch of tests? If I walked in and said, I got some memory problems, what would you do?
The first thing with any patient is get a good history and physical.
Amen. That's the most important part of medicine, is sitting down, talking to the patient, listening. If all else fails, listen to the patient. They'll tell you what the diagnosis is.
That's exactly right. So listen to the patient, listen to the family member. So it's really great to have another person present to help with that history.
So what does the other person do? How do they help you?
They can help because sometimes individuals do not recognize some of the symptoms. So maybe you're forgetful, but a lot of us are forgetful with aging, but the kind that we're really concerned about when it's someone's having difficulty with directional sense, losing their wallet, losing their keys, but not realizing that that's happening.
So that you can, if you got a wallet, you need to know where it is. And if you don't know where it is and you can't figure out, or you don't know you've even got a wallet, which one of those fits into understanding the diagnosis by a friend?
Well, it could be all of the above, but the main clue that there's a really serious problem is when someone has something called anosognosia, the inability to recognize your own deficits. So when you, for instance, let's say you're getting lost and you end up in another state, not realizing right away that maybe you're on the wrong path.
So what if you're in a parking lot and where's my car? Is that a sign that you may be getting some problems?
Not necessarily. Some of us in this busy world are multitasking to the point where we're not paying attention. Now, if you said, I know I'm exactly in spot A6, and you really commit that to memory, but then you get outside and you have no idea where your car is, that's a little bit different. So if you can clearly make a mental note to remember your location and then you can't retain that information, that's more concerning.
What if somebody walks out and said, how did I get here? Do I have a car? Was it a car? Was it a bus? Did an airplane bring me in here? What's an airplane? When they're that confused, what are your thoughts there?
That is a sign of overt neurodegenerative disease.
Overt neurodegenerative disease.
That means there is a problem, there is a disease, there is a dementia. Even though I don't like the word, we can use it for the purposes of describing this. And then in addition to that history and physical, listening to the story, we get cognitive testing, pen and paper testing. There are computer tests as well that help identify different domains of thinking. So it's not just memory loss. You can have visual spatial problems, executive function problems.
Example of visual spatial. What's an example of that?
A great example is directional sense. So we have a place in our brain that's towards the back of the brain that's important for the maps of our brain. So for instance, if you're trying to get to work every day, most of us are pretty good with that, or going to the grocery store, but maybe there's a place that you've been a handful of times and not having any idea how to get there. Well, that's a little bit concerning.
Well, sometimes I just ask my wife now, what direction, where do I turn left and where do I turn right? Is that abnormal?
Well, I think the problem in today's world is we also use GPS. We don't commit to memory like we used to. So, and that's not a bad thing. We have these tools so that we can use our mental energy elsewhere. But the key here is getting the cognitive testing, the pen and paper testing, and then also doing imaging. So imaging is so essential to the diagnosis.
Tell me about imaging. Why is that essential to the diagnosis?
It's essential because we can look for different patterns, different areas of atrophy or shrinkage on the scan to give us a clue.
You can see that.
Yes,
so
you can see that.
That's an objective finding that you've got with that special x-rays.
Absolutely. So it's an objective finding, but we usually start with an MRI or a CT scan, and if that's not conclusive, and that gives us structure, what your brain looks like, then we can proceed to something called a PET scan, fluorodeoxyglucose PET, and that type of scan shows us how our brain works.
What kind of PET was that?
It's a sugar scan.
Okay. And what it does, it shows the heat of the sugar that's there, and that will outline if there's anything active going on in the brain.
So you want the whole brain to light up. Remember, we use all of our brain all of the time, so we want to see activity throughout the brain, and so we're looking for voids, area of the brains that are not working. So the PET scan is really important for that. Now, there are other types of PET scans, and Medicare has just approved the use of the amyloid scan.
And where does amyloid fit in all this?
Well, the main finding in Alzheimer's is both Alzheimer's plaque or amyloid plaque, as well as the tau tangles. So if you can see an autopsy finding in a live, healthy person, that is fabulous. That's how we want to diagnose.
So if we find that somebody does have Alzheimer's, are there any new treatments that we have available?
Absolutely.
And
Several.
that's what we're going to be talking about when we come back. What are some of the newer treatments? What do we do once we have the diagnosis? How do we handle the patient at that time? A lot of information. You'll want to stay tuned. We're talking with Dr. Monica Crane, medical founder and director of Genesis Neuroscience in Knoxville, Tennessee. And we've been talking about Alzheimer's versus dementia. We don't really like the word dementia. We like to get closer to what is going on with the patient. Now we're going to be talking about, is there any new treatment that helps either prevent it from occurring or gets rid of the problem? You were mentioning some problems as far as some of the proteins that are available. What's new?
There are so many exciting new treatments. And so there are two drugs. One was fairly controversial, called aducanumab or Aduhelm, and it removes amyloid plaque, sort of the medium-sized clumps, the fibrils.
So is this a biologic type
Yes,
thing?
it is a biologic. It is a monoclonal antibody. So basically,
Monoclonal antibody.
yes, sir.
So that's an antibody that's made directed against that protein that we want to get rid of.
Yes, it is. And it's like an immunization. So with the first drug, it was pretty controversial because it looked like it was mediocre at best in terms of efficacy. However, it opened the door for future drugs. So we do have some patients, a few patients taking that drug, but we're really excited about the second drug that just got full FDA approval, lecanemab or Leqembi.
Lecanemab. So that sounds again like
The first
biologic.
one. Yes, yeah, it's another biologic, again, targeting Alzheimer's plaque, but this time it's targeting pieces of plaque that are a little bit smaller, the protofibrils. So that's a fancy name of saying that smaller chunks that are already toxic to the brain. And so by clearing those, you don't get bigger pieces, and then ultimately you don't get the large amyloid plaques.
And if we do that early, we can maybe, just maybe, prevent Alzheimer's or a type of dementia from occurring?
Well, we slow the disease, about 27% slowing, which is amazing because what do we care about the most? Quality time with our friends, our family, with our occupation, and those are the most important things. What our brain looks like, well, nobody really cares.
That's right.
But can we put the brakes on the disease long enough that we can get yet another drug? Think about it like the nascent cancer treatments. Those first cancer treatments, they weren't perfect. These drugs aren't perfect, but they offered real hope, and I do believe that these drugs offer real hope.
So the hope that we've got is the patients can live a semi-normal or normal to everybody else and still have a little bit of the abnormal proteins. Is that correct?
So if we remove a lot of the amyloid plaque, the hope is that we slow down the second protein from accumulating, which is the tau or the tangles. So we still don't have a great treatment for that. We'll get there. Think of these drugs as chemo for the brain. They are IV infusions, so it is pretty cumbersome.
What do you mean by cumbersome? If I could get rid of these abnormal proteins by coming in and getting an intravenous treatment, I'd be running there as fast as I could just to get into put my arm out at the door of your office.
Well, there are side effects. One of the side effects can be brain bleeds, some brain swelling, or a stroke. So you have to be pretty selective as to the type of patient. So if somebody is on a blood thinner, that's not good. Or if somebody has a pacemaker, it's going to be hard to do MRIs. You have to do a lot of MRIs. And for some patients, that's not affordable, or lots of individuals are unable to tolerate an MRI, but you have to have an MRI frequently. So that's the downside of the drug.
So that could be an expense, or it could be, is that covered by insurance? Usually, mostly,
Well,
depends on the patient?
So far, if you have Medicare, a lot of it is covered as long as you're the appropriate candidate. You have to check the boxes. You have to be healthy. So remember, age does not predict health. Age is heterogeneous, meaning we all age differently. So you could have someone who's 80 and is healthier than a 50-year-old. So you can't look at someone's biologic age. You have to see how that individual functions.
I think that's such an important statement, that when you talk with the patient and you look at the patient and you interact with the patient, you know basically if they're healthy or not healthy from a central nervous system standpoint. So there's lots of hope for people that are forgetting certain things, that wonder if they have Alzheimer's, and we find that they do have it. Do you tell people you've got Alzheimer's, it's just in the background and you'll be able to do everything you want to do? What do you tell the patient?
So I believe that we tell patients once we have protein confirmation, so we do spinal fluid analysis, or we can do the amyloid scans, the scans that show plaque. So we are going to change the way we diagnose people. Instead of diagnosing them at the first visit, it's going to take this additional testing and the proof of the protein. So for instance, if your doctor saw a tumor on a scan, they would probably wait for a biopsy in order to confirm a cancer. So it's kind of the same way. We do not want to take a chunk of brain. So instead, we can do these other tests to find the protein, and then we call it Alzheimer's. But my hope is that at some point, we can sit around the dinner table with our friends and say, hey, I have Alzheimer's plaque in my brain and I'm getting treatments. And it won't be stigmatized as a dementia, but rather a condition that you get treated for before symptoms.
A lot of times we look and say, oh, they've got Alzheimer's. That's what we don't want. We want to say, hey, what stage is your Alzheimer and how are you doing with it? And let's go play a game of cards.
Absolutely.
Yeah, so they get to live a functional life. I think that's terribly exciting, as exciting as anything could be. So can you see people that get the diagnosis and perform well?
We have patients that do exceptionally well, especially the ones that come in early when the symptoms are very mild. So the key is when you have mild impairment to get a diagnosis, those are going to be the patients that are eligible for these new treatments.
So what would be an example of a mild impairment that you would find on me if we just were at a dinner table together and you observed me? What would you be looking for?
Well, I don't think you can diagnose by observing someone. I think you also have to have that history. Some people have always been forgetful, but that's their baseline. You have to know someone's baseline function. So let's say you were terrible with names and continue to be terrible with names. Well, that's not a problem. We're looking for a change. So you have to have a little more history than just observation.
So looking at the patient overall, where does this improvement, or does this improvement help somebody's wellness, their wholeness, their ability to perform as a human being?
So when we do all of the treatments together, so we think with these new drugs as well.
That's what we're going to talk about when we come back. Amazing the information that we're getting on preventing the symptoms from coming by finding it early and being able to knock out things, hopefully where they'll never progress in the future. A lot more information. You want to stay tuned. We're talking with Dr. Monica Crane, medical founder and director of Genesis Neuroscience in Knoxville, Tennessee. And we have talked about the quality of life. We've talked about being able to find little small abnormal proteins that will eventually go on and cause Alzheimer's or a dementia disease or Lewy body disease or chronic traumatic encephalopathy, some of the things we've talked about. Now I'm going to want to talk about, I want you to refresh my memory, because that's what we're talking about, memory. How important is all this to me? What's it going to do for me? Here I am out there. I don't know I've got anything. Testing has shown I've got some very early beginning. What's my life going to be like?
Honestly, early diagnosis is so key. Individuals can lead normal, healthy lives. We have patients that had early treatment, and remember, treatment is not just these intravenous drugs. So the new monoclonal antibodies, these vaccines against Alzheimer's, those are the big treatments. But it starts with little things. There are other pills that have been FDA approved for years and years that do help slow symptoms. But it all comes down to also making dietary and lifestyle changes.
So dietary and lifestyle changes will help in the prevention, the slowing, the slow down development of these diseases?
All of the above. So, for instance, it's never too late to start exercising, meaning if you are a non-exerciser and you are, let's say, 70, 80, and it's not too late to get started with the program. Regardless of your ability to ambulate, there are some people that do need a device to walk. Well, you can still walk with your walker.
Yeah.
So the idea is get moving, and the goal is to do at least 30 minutes of movement a day.
30 minutes of movement every day. Get out of bed, get your walker and get with it, or get your tennis shoes on and do something with them for 30 minutes. How many times a week?
Well, if you do 30 minutes every day, 7 days, that's ideal, but the goal is 4 hours per week total, minimum. So if you do a whole lot more, let's say you do an hour a day, well, great. That's even better. But do what you're able and start in small increments if you're a non-exerciser. But the key is you have to move. We think it upregulates an important brain chemical that helps neurogenesis or development of neurons. So exciting.
I remember the word when you've been on the show before, neoneurogenesis, where it's the development of new nerves there. So if we can do that, what about vitamins?
Well,
do they help?
Well, yes and no. I think, let's say if you have your donut with a handful of vitamins and your soda, I don't think the vitamins are going to help much. So the key is, let's say we all have something to improve in our diet, in all honesty. I mean, maybe there's an exceptional person that has an absolutely clean diet, but the key is to eat real food, to try to stay away from fast food, processed foods, as well as any artificials, particularly artificial sweeteners.
So that's so important. We've got exercise, we've got nutrition. Where does sleep fit in there?
Sleep is huge. Deep sleep is the time we repair our brain, and so we need that deep sleep. So for instance, some people have conditions like sleep apnea where they're not breathing at night, and so it's important to get that diagnosis and use your CPAP or BiPAP. It can protect your brain. So we tell people that are younger that don't yet have a neurodegenerative disease to definitely look into sleep, because that could potentially prevent a future neurodegenerative dementia.
Dr. Monica Crane, you're amazing. I love having you on the Dr. Bob Show. It's always an honor and it's always a pleasure. And now I want everybody to remember those 4 things that we think are so important. And we just got through talking about exercise, what exercise can do. It can help us develop new brain cells, neuroneogenesis, big old long medical words. That means exercise gets your brain working. Sleep refreshes. 7.5 hours sleep is what we like on the Dr. Bob Show. That will help your brain refresh itself. It's like washing out the bad stuff and leaving just the good stuff ready for the next day. And so it's so important that we're eating the proper foods and getting the proper sleep. 7.5 hours sleep. What kind of foods? More fruits and vegetables. You know what good foods are. You know what bad foods are. Stick with the good foods and only the good foods. Every time you eat a bad food, say, bad thing to do. We got to stay away from those bad foods. And most of all, what is it we like in the Dr. Bob Show? Is that laughter in your life. Laughter and socialization. It helps you in your interaction to prevent Alzheimer's for a type of neurodegenerative disease just by being with people. It excites the brain. It tells the brain to be happy, to be excited, to live a longer life. And remember, if you do that laughter, you'll stay healthier. So have laughter in your life and see if your health is not much better.